And welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. We assist busy professionals to find solutions for both their acute and chronic medical needs. We do this via our primary care, COVID-19 testing, COVID-19 vaccines, concierge medicine, telemedicine, through our best selling book, Vitality, that is sold on Amazon, as well as on our website, as well as through each week on CBS 42 News House Calls at every Monday morning at 6:30 a.m. So good afternoon, ladies and gentlemen. Today's topic for Let's Chat is COVID-19 long hauler syndrome. I thought what would be great is to kind of talk about what is long hauler syndrome. There have been a few more questions that we've been getting this week about what is it? How long does it last? Is there anything I can do? All of those kinds of questions. So we thought that we talk about that today. So first, let's talk about what is long hauler syndrome. Long hauler syndrome is a condition or disease that is the persistence of certain symptoms of COVID-19 that some patients may have. Now, of the over 32 million Americans that have been diagnosed with COVID-19, 10% of these patients experience what we call long hauler syndrome. And so let's talk about what are those symptoms of long hauler syndrome. The four most common symptoms that patients complain of include, but are not limited to, but the four most common are loss of taste, loss of smell, shortness of breath, and fatigue. These are by far the four most common complaints that patients complain of that persist beyond the 10 or 14-day quarantine period that you're under when you are diagnosed with COVID-19. So those are the most common symptoms. It also can include, a lot of patients will come in and say, hey, I'm having difficulty concentrating. I feel like I have brain fog, and there are a couple of different reasons why you might have that. We'll talk about that in a moment. Sometimes people complain of having headaches, muscle pain, dizziness, anxiety, as well as PTSD and depression. Now, a lot of times patients will also complain of intermittent fever or having a rapid heart rate. So let's talk about the brain fog symptom for just a moment. Now, there are different characteristics that people will use to describe their brain fog feeling. Some of those include, well, I have just a little bit of difficulty concentrating. Some of it is exacerbated or caused by even fatigue. So you can get chronic fatigue with COVID-19, or you can have the long hauler symptom, which can be fatigue, but we would say it's a chronic symptom of COVID-19, and therefore long hauler syndrome symptom, and that would be fatigue, right? So a lot of people complain about having fatigue long after they've had their COVID-19 infection. A lot of times for some patients, that fatigue combined with either headaches or some kind of other symptom that's persistent with them can allow them or cause them to have difficulty focusing or concentrating on those things that they normally would be able to very easily focus or concentrate on. And this is a very underrated symptom that sometimes people don't realize. Sometimes people are suffering with it and don't realize that they are. Just have a problem bringing things to remembrance and that kind of thing. So there are a lot of studies that are being taken place right now in studying this particular disease. They're in the British Medical Journal. They recently published 70%, and this is part of the reason that we decided to use this as our topic today. There are a lot of people that are affected by this that don't know that they're affected by it, and there's some things that we can do sometimes that can help these symptoms, and so we'll talk about that in just a moment. But very interestingly, a lot of times people think, oh, you only get long hauler syndrome if you have other chronic comorbidities like heart disease, asthma, diabetes. Well, this study revealed that 70%, and this is from the British Medical Journal that I'm quoting from, 70% of the people with low risk mortality. And so when we say low risk mortality, who are we talking about? But 70% of those people with low risk mortality had impairments in one or more organs at least 4 months after the initial symptoms of COVID-19. So let's kind of break that down. 70% of people with low risk mortality. What that means is 70% of people that have low risk mortality, which would be death, and those persons would include people that don't have a history, no diabetes, no heart disease, no high blood pressure, no, someone that's considered relatively healthy. And 70% of these persons had impairments in one or more organs 4 months after initial symptoms. Now, we know that COVID-19 can affect our lungs chronically, it can affect our heart, it can affect our kidneys, it can affect our GI system, it can affect you neurologically, it can affect every organ system, right? And so what this study found is that 70% of those people that you would think would not suffer from mortality or a long-term complication actually had symptoms that persisted 4 months beyond the initial symptoms. So what that means is that long hauler syndrome can happen to anyone. That's a long story short of what that means. So that means that it needs to be something that we're all cognizant of and aware of, and that we know that as we are moving about the cabin, so to speak, in the last couple of months with, us being in a resurgence of COVID-19, and now Alabama being declared a state of emergency with the COVID-19 resurgence, it means we need to be extremely careful about making sure that we follow and utilize those tools in our arsenal that we know help to decrease the spread of COVID-19, such as social distancing, washing your hand, wearing a mask, and then one of the latest pieces we have in our arsenal that we need everyone to pick up, and that is getting a vaccine. So why is this important? It's important because a lot of times there are a lot of people that think that if you get a COVID-19 infection, you don't have to worry about much. It's not going to be, you'll have a little cold for a week or so, and then you'll be done with it. Well, a lot of people aren't done with it once they get the simple infection. And that's the point about the need to prevent the infection to begin with, so that you don't have to deal with long hauler syndrome. Okay. Now, in addition to that study in the British Medical Journal, and there are lots of studies that are going on. I know that UAB has a study going on now as well. Yale Medicine put out a journal article in May of this year that showed that 30 to 40% of long haulers who receive the vaccine notice a decrease in that long hauler syndrome symptom. And so what that means is that, they released a study in May that showed of the patients that they'd been studying that had long hauler syndrome, 30 to 40% of those patients noticed a decrease in the long hauler syndrome symptom once they got vaccinated. So that's one thing that we can do about it, okay, is to get vaccinated if you're not already vaccinated, in addition to, of course, preventing getting COVID-19 to begin with altogether. So let's talk about that for a minute, or let's dispel some myths really quick first before we talk about the fact that the vaccine has been shown to have a decrease in long hauler syndrome symptoms in those patients that were studied at Yale Medicine. So I was asked this question and wanted to bring it here. If I tested and I tested positive, but I was an asymptomatic person that have COVID, can I get symptoms later if I don't have it with the initial disease presentation? And a lot of people will say, no, if you don't have symptoms to begin with, you won't develop symptoms. That is not true. It actually is likely. It is likely for some patients that you can get symptoms later, even though you don't have any symptoms initially. And for those patients, sometimes patients will present and say, oh, I was exposed, I need a test. At the time they don't present with symptoms, a week later, they may start having symptoms, or even a couple weeks later, there have been patients that have symptoms. So it is possible to present initially with no symptoms, but develop symptoms later on. So yes, that is a possibility. Okay. Second myth, if I lost my sense of taste and smell, will I ever get it back? Actually, 95% of the time, yes, you will. It may take months for you to get it back, but you will. Most patients that experience a loss of taste or smell with an active COVID-19 infection typically experience that anywhere from 1 to 2 weeks. On average, it's about 2 weeks. Some patients present and say, oh, I only had it for a couple of days. Most patients are in the 2-week window. Majority of patients, after about 6 or 7 weeks, the majority of patients will have regained their sense of smell and taste. for those patients that have the long hauler syndrome, right? That, you know, they're asking, hey, will I ever get my sense of taste and smell back? And they're doing studies on that now, but they found that 95% of the time that the patient does regain their sense of taste and smell. It may take months to happen, but typically they do. And it's possible, they're studying this now. One of the things that has been suggested that can help with that loss of taste or smell is actually doing a re-sensitization, wherein you allow yourself to smell 3 different smells, same 3 smells, over a period of a couple of weeks, and you do it every day. Wherein, like, coffee beans or lavender, and all you're going to do is smell that, and it's almost like you're kind of retraining your nose to be resensitized. Now, I've also had patients say, you know what, I had that loss of taste or smell. I got vaccinated and I noticed that it started coming back some, right? You know, did the vaccine help? They're studying that now, but what they're seeing is that people that get vaccinated, as I said before with the Yale study, who receive a vaccine, 30% to 40% of those people are noticing, hey, this is helping with that long hauler symptom that I had. And so what they're theorizing is the way that the vaccine could possibly help with that is that the vaccine helps to decrease inflammation, right? And with the process that it helps to do that, that is what causes those helper cells, and trying to not get too technical on you, but they're helper, what we call helper cells that are a part of your immune system. They help your body to fight off infection. And what we're seeing is that it may be these cells that are affected on your, what we call your olfactory nerve. That is the nerve that exists here. It's it helps to give you your sense of smell, right? So if you're having an irritation with that nerve or inflammation there, that can be causing the loss of taste or smell. So it's showing that the vaccine kind of helps with that inflammation in some way. There's not a direct link, and that is not proven, but they're studying that, and that is what it seems to be happening at this point. So what does all that mean? What does all this mean? The 2 points with the Let's Chat for today, 2 points. Number one is that we need to be acknowledgeable that the long hauler syndrome exists. Again, the 4 most common symptoms people have is loss of taste or smell, loss of taste, loss of smell, shortness of breath, and fatigue are the 4 most common long hauler syndrome symptoms. Again, you can have brain fog, headaches, muscle pain, dizziness, anxiety, depression, PTSD, difficulty concentrating, intermittent fever, elevated heart rate, all of those things. I've had patients say, it's been 4 weeks since my COVID infection. I had a little bit of a temperature when I woke up this morning, that kind of thing, but no other symptoms, no cough, their chest is clear, no active infection going on. That's just an intermittent symptom that's kind of lingering, part of the long hauler syndrome. So the point with today is we need to acknowledge that long hauler syndrome exists. Number 2, if you're not vaccinated, I would like you to be in acknowledgement, or to have knowledge of, that these symptoms can happen to you over a long period of time. And when we say over a long period of time, we mean more than 4 or 5 months. We mean up to 9 months to a year, that people are going without being able to taste their food, without being able to feel like they have energy, without, feeling like they're breathing. And these are normal, healthy people, don't have asthma, don't have COPD, don't have heart disease, don't have heart failure, that are having shortness of breath on a chronic basis as a result of a COVID-19 infection. So the vaccine helps to decrease the likelihood of you getting an infection, severely helps to decrease or mitigate the risk of you getting an active infection. We know that it does that, right? Some research is showing that it also may help to decrease symptoms of long hauler syndrome. The second reason why we need to be in acknowledgement of long hauler syndrome is that there are patients, unfortunately, that are suffering with chronic anxiety. They've never had anxiety in their life before they had COVID, and they're struggling with anxiety. Some people are dealing with PTSD, which is post-traumatic stress disorder. Post-traumatic stress disorder is a psychological disease that happens after a traumatic event. For a lot of people, whether it be they've had COVID themselves, they've had a family member to pass from COVID, they've watched someone's life degrade over a period of months as a result of having a COVID-19 infection. They've undergone different kinds of emotional issues as a result of a targeted trauma, right? Well, some people that have suffered with COVID have undergone a complete transformation in their life where they were happy, healthy one day, running, jogging, working out, feeling normal, having COVID, having, breathing or respiratory restrictions, being put in isolation, suffering, may have been on a breathing machine, may have had to be on oxygen, had to be isolated away from their family so a lot of these things go into play in someone that could possibly suffer with PTSD. It is a real disease. It can cause all kinds of problems in one's lifestyle that affect your ability to get along and with your activities of daily living. So that's why we need to bring awareness to it. There's people that are suffering with chronic anxiety as well as depression after having a COVID-19 infection. So if you or someone you know is suffering with any of those, please make sure that you see your primary care physician, whether it be it's anxiety, depression, PTSD, having chronic breathing or respiratory restriction issues, shortness of breath, fatigue, loss of smell and taste. If you're having any of these chronic symptoms, please see your primary care doctor so that you these things if it's possible, especially with the anxiety, depression, and PTSD, because that is going untreated and is causing issues for a lot of patients. So that's why we're trying to bring awareness to it. So if you have someone or you know someone that has had COVID-19 and you feel like, hey, this may be someone that's suffering with anxiety, depression as a result, they may not even be in realization that it's a thing. So that's another reason to bring awareness. So if this has been helpful to you, if you feel like this applies to someone that you love or someone that you know, please make sure that you share this information with them and that you encourage them to see their primary care doctor. Also, encourage them to make sure that they get a vaccine if they are not vaccinated already. Now, the last thing we were going to talk about was the brain fog and the fact that with the brain fog, sometimes people don't know, they don't realize, I've got a little bit of a brain fog going on. Sometimes people don't realize it. And you being on the outside looking in, or being someone who may have heard more, read more, seen more in relation to COVID-19 can help those individuals. So if you see someone that you know or you love that's suffering with that, please make sure that they see their primary care doctor. It is a real disease process that needs to be addressed. Okay. So again, those four most common symptoms of long hauler syndrome: loss of taste, loss of smell, shortness of breath, fatigue. What can we do about it? Number one is see your primary care doctor so that any of these things that you're suffering with can be investigated. If you are having a chronic or restrictive or breathing issue, I strongly encourage you, very important, to see your primary care doctor so that that can be addressed, so that if we need to put you on meds, you may need to have a pulmonary, what we call a pulmonary function test, which is just a test that we do to assess, okay, how's this lung function, to see, hey, do you have any kind of restrictive disease pattern? Is there something that's going on as a result of you having had the COVID-19 infection? So we want to be cognizant of that. And then lastly, the thing that we can do most to help prevent COVID-19 long hauler syndrome is to be vaccinated. And if you're not vaccinated, I encourage you to definitely get vaccinated if you're in Birmingham, Alabama, or the surrounding areas, or anywhere in Alabama or wherever, and you want to be vaccinated. We do offer vaccines at our office. We have Pfizer as well, which is a 2-dose vaccine, and as well as Johnson & Johnson, which is the 1 dose. Our office number is 205-291-8842. I think that by now you're able to also schedule an appointment on the website. In addition to that, if you do not have an appointment, if it is Monday between 8:30 a.m. and 3:45, 4 p.m., Monday through Friday, you can come to our office and get a vaccine even without an appointment. So No matter if you're in the Birmingham area and you decide, or you know someone that decides, hey, I want to get a vaccine, and they've decided that day they want to do it, you can come to our office and get vaccinated with or without an appointment. We really are trying to do our part to help the community get vaccinated, and so we want to be a resource for those. In addition to that, we're also offering COVID-19 testing. We've seen a dramatic increase in the number of patients that we're testing for COVID-19. I encourage you, if you are in the state of Alabama, or actually anywhere in the country for that matter, that you, when you leave your home, be sure that you mask up, be sure that you social distance, be sure that you are washing your hands on a repetitive basis. Remember those things, the tools in our arsenal that we used last year to fight COVID-19 being the social distancing, washing our hands, and of course, our favorite way to help prevent transmission is the mask. Is making sure that you're masking. I encourage you, if you're a parent, please go over this in detail with your children and at home, so that they know, hey, this is how we keep safe when we're at school. And you can even make it into a game or something very active for the kids, so that they know how to protect themselves when they go to school. I know that we're seeing an increase in the number of cases in various schools across the community. So in addition to that, does anyone have any questions? Anyone have any questions? Hi, Pretty Barbie. Thank you for joining us. Hi, Ms. Jones. Hi, Dr. Jaquel. Thank you so much for joining us today. Hope you're doing okay, Dr. Jaquel. I'm sure you just got off one of your many, many speeches or addresses that you had. Anyone have any questions? I hope everyone is doing well. I don't know if you all saw that they are looking at now extending the doses for those who are immunocompromised. I think that was approved already. And so we anticipate that they may be approving a booster dose for anyone in any of the non-immunocompromised persons probably soon. At least we hope so. Anyone have any other questions? Any other questions? If this information has been helpful to you, please make sure that you share it with someone. If you have a loved one that's suffering with the long hauler syndrome, please encourage them to see their physician to see what things can be done to help this long hauler syndrome. Because sometimes when people experience that chronic symptom over a long period of time, especially if they're in an environment where they feel like no one kind of understands it because other people don't have it, especially if you're in an environment that the people around you may not be sensitive to COVID, unfortunately, that patient can sometimes feel like they suffer a depression because they feel so alone. So please make sure that we encourage those persons, and that you encourage anyone in your family that's experienced it to definitely see their physician. And if they are not vaccinated, please, please, please encourage them to get vaccinated. Okay, so that's all we had to share with you guys today. I hope that this was helpful. We're looking for new topics. I'm not sure what you guys want to talk about. Ms. Jones says, why would you need a booster shot? Why would you need a booster shot? So Ms. Jones, the CDC is studying it currently, as well as Pfizer, their shot, and Moderna. They're studying how long the immunity lasts in patients. With the current resurgence of so many cases throughout our country, and because there's so many people that are unvaccinated, the unvaccinated population leaves a reservoir, more of a reservoir rather, for COVID-19 infection to spread in that population, because it's easier for COVID-19 to use those individuals that are unvaccinated as a host to make more copies of itself or create more of itself because they're unvaccinated. So they're studying now to find out, to help decrease the spread, if a booster shot will help to give us a boost in the immunity that our immune and the antibodies that are being produced by our immune systems as a result of the vaccine. So a booster dose would just help to kind of give your immune system a pop or a boost in helping it to produce more antibodies against COVID-19. So that's why you would need a booster shot. We anticipate that that will possibly be approved soon. They've already immunocompromised populations, but part of the reason, you know, when the plan was initially put together, or when they initially released the vaccines, let me say it that way, when they initially released the vaccines this past winter, the anticipation was that most people would get vaccinated. We needed 70% really of the population to get vaccinated to rid our community of COVID. Unfortunately, we did not have 70% of our population to get vaccinated. Therefore, it left a reservoir, left time, because the thought is, let's get everyone vaccinated so that so that COVID doesn't have a reservoir to live, because it won't have that reservoir to live in the patients that are vaccinated. What has happened is we didn't get enough people vaccinated. We didn't get enough people vaccinated, so the booster is just going to help boost our antibody production against COVID-19, and we're needing that because COVID is still here, unfortunately, which is why we're really, 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 really pushing, and why if you are out there and you have friends or family that are unvaccinated, if you have a story, and let's just say you're someone who initially I say that initially you were vaccine hesitant and you didn't want to get a vaccine initially. Something convinced you that it was a necessary thing for you to do. And at this point, to be honest, it's a necessary thing for all of us to do. It's a part of doing our part to help save our community and save humanity, because at this point, as you're seeing it soar across the country, healthcare systems are being stressed to the max. I know that I saw a report that, and I don't want to misquote, most of the hospitals in our community, I know in Birmingham, have been on, several of them have been on and off what we call ER diversion. And all that means is that they're at their capacity for their ICU beds. ICU beds are what is necessary for a patient to be on a ventilator. So those beds are taken up by COVID-19 patients, right? So because there's so many people unvaccinated and there's so many people that it's spreading to, it's just causing a lot of stress on the healthcare system. So at this point, we need everyone to be vaccinated. So share your reason why with someone. If you're listening and let's say you're like, hey, you know what? I don't want the vaccine. I'm not going to get it, that kind of thing. This long hauler syndrome is what you don't want. We know that COVID can cause chronic effects on your kidneys. We need our kidneys to filter, right? We need to filter our blood and remove toxins. If it affects your kidneys, you can have chronic kidney disease. People that suffer with chronic kidney disease sometimes have to be on dialysis, where they're tied to a machine for 4 hours at a time, about on average 3 days a week. So 3 days out of their whole week, they spend most of their day tied to a machine to filter their blood through. It can affect your heart. We know there are all kinds of heart disease things. You can develop heart failure. You can develop heart disease as a result of COVID. All of these things that can happen as a result of COVID. It can affect you neurologically. You can lose your sense of taste and smell. You can have chronic headaches. You can have this chronic brain fog, inability to concentrate. You can have chronic headaches, chronic muscle pain, chronic dizziness, chronic anxiety, chronic depression, all of these things as a result of COVID. The vaccine itself has an extremely low side effect profile and has shown, we know it because even if I didn't tell you, you could tell me. If you just looked at what happened over the last year and say, okay, there are 2 times in the last 18 months that we saw a definite decrease in the cases of COVID-19, right? Pointed decrease, severe decrease in cases. The first was when there was a national mandate or a federal mandate about mask wearing, mask ordinances through state governments, etc. The second was when we got the vaccine. The vaccine helps to decrease the spread of COVID-19. It mitigates the risk of spread of COVID-19. It just does. So if you don't want the long hauler syndrome, if you don't want COVID infection to begin with, you've got to get vaccinated. I have a lot of people that have been coming to our office now saying, oh no, someone in my house has it. Can I get vaccinated now? Well, first, we've got to make sure that you don't have COVID-19. Then we need to make sure you're clear through your quarantine period. Then we can vaccinate you, but it's still going to be 5 weeks until you have immunity. That's why it's important to do it now. And we need everyone vaccinated now. We're seeing the spread in the schools, and the spread that you're seeing in the schools, right? Like, why are we seeing it spread like wildfire in schools? Well, our little people, they can't get vaccinated. They cannot get vaccinated. So they're going into an environment wherein, which is why them wearing a mask is so, so important, because that's like the only little protection they have, because they don't have a vaccine. They don't have an immune system that's producing antibodies to COVID-19 infection like the adults that enter the school do. And God bless the teachers, Lord bless the teachers for what they're having to, the situation that they're in. So we just need everyone to get vaccinated. And so she says, so I have to get a booster shot. I'm not saying that you have to get a booster shot now. They have not approved that. On Friday, if I'm not mistaken, it was Friday, they approved for immunocompromised patients to get a booster shot. So I want to make sure I'm very clear here, because I don't want to cause any miscommunication. They have not approved a booster shot for COVID-19 vaccinations. They are studying it and considering it, and may have a decision about that very soon. But they've already approved it for people that are immunocompromised. Immunocompromised people are people who have any kind of autoimmune disease, people that have cancer, people that have diabetes, immunocompromised persons. So I'm not saying that you have to get a booster shot now unless you fall into that category. But that was only recently approved. So what I would encourage you to do is call your physician. Well, first of all, it depends on if you're immunocompromised. If you're not immunocompromised, there's nothing for you to do. It's just wait. I was just mentioning the fact that it's been in the news about the possibility of us needing a booster shot because of the resurgence and the persistence of the Delta variant throughout our communities. That's what I was saying. Maybe I shouldn't have mentioned it at all, because I don't want to alarm anyone, but it is something that's been in the news over the last couple of weeks. They have not approved it yet, though. But I have had people asking me, saying, hey, can I get my booster shot? And it's like, no, it's not time yet. It's not approved for everyone yet. Does that make sense? I hope that was clear, Ms. Jones and Pretty Barbie. I hope that was clear. Anyone have any other questions? So no, so for right now, if you're not immunocompromised, the only thing for you to do is continue to mask up. Make sure that you're socially distant when you leave your home. Make sure you have a mask on when you leave your home. Make sure that you wash your hands and that you're careful. And that you have your hand sanitizer, clean your hands and things once you've gone inside a store, gone inside a restaurant, any of those things. Any other questions? Make sure that you're careful. If you're going out and you're going to the gym, make sure that you're wiping down, your equipment. Outside, of course, is safest. And that's it. Anyone have any questions? Any other questions? I hope that was helpful. Okay. So again, okay, you're welcome, Ms. Jones. I hope that was clear. So just kind of talking about some things that are kind of coming down the pike in terms of what's going on, at least in our community here in the state of Alabama. Just a really big push, very big push to get everyone vaccinated. If you have a family member that's not vaccinated, please talk to them. Please get them to a health professional that they trust, or that you trust if they don't have one. So that they can have the conversation. It's a very necessary conversation. There are a lot of people that are in their 30s. The majority of the patients that we're testing now, I would say easily, and I'm guesstimating here, easily 70% of them, 70% I would say, are in their 30s, 20s and 30s. Not a lot of older patients being tested at all, unless they're exposed by someone else. Kids, of course, being exposed from school, we're testing a lot of kids. And we do test kids of all ages. We're family board certified in family medicine, so we do test kids of all ages. But let me just say this also, we're going to do a Facebook Live about this, I hope, maybe tomorrow. But there's another viral illness that's out there that's affecting children. RSV. I'm not sure if you guys have heard about that or not, but we're going to try to do a Facebook Live and talk about that tomorrow. A few of the symptoms are the same as COVID, as it's going on right now, during this time, or they're seeing a tick up in the number of cases that has to do obviously with us stopping the mask wearing and but now we've restarted it. So hopefully we'll see a decline in that, but it's just something for another thing for parents to be aware of. So we'll hopefully have something for you guys for that tomorrow. Okay. So we went a little over today. Sorry it's lasted so long. Thank you guys for logging on. Thank you for your questions. Thank you for tuning in. And thank you for your support. If you are in need of COVID testing or COVID vaccines, again, we offer those Monday through Friday, 8:30 to 4 p.m. Give us a call for an appointment, or you can go online and make an appointment at drcelestec19.com. It's drceleste.c19.com. We will be back with you sometime later this week and talk about RSV and COVID-19 in kids. That's all we had to share with you today. Again, I'm your board certified family medicine physician and your favorite urgent care physician. You can reach us again at 205-291-8842. Have a good day. Happy Sunday. If you go outside today, please make sure that you sunscreen up. Definitely get some vitamin D, and please make sure that you're remembering all the things that we talked about before that immune system, not limited to exercise. Yes, 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 yes. My favorite one, exercise. Number 2, making sure you're drinking plenty of water, making sure that you're taking your supplements to help support your immune system, getting plenty of protein and plenty of fresh vegetables. Okay. Have a good Sunday. Bye-bye.